Hi, my name is Stephanie Nolting. I work at Physical Therapy Connections, and I wanted to share with you for Technique Tuesday a few things that can be done after spinal fusion. Everybody after a spinal fusion has to be very careful with all bending, lifting, and twisting. So you're not supposed to bend because everything that they just made stable in your spine, you don't want to start to undo the work that they did. But you can hinge at your hips. You just can't bend at your spine. So practicing, especially if you can practice before surgery, bending at the hips, but not at the spine. So that technique of if I'm sitting in a chair and I need to reach forward, I can bend at my hips, but not at my spine. So the technique in doing that is very important because there's a huge difference between those two things. Same thing with bending. You're not allowed to bend because when we bend, we should round our back if we have not had a fusion. After a fusion, you can hinge at the hip. So if you need to get something lightweight off of the floor, bending at your hip, if I use this one, is okay as long as your back stays straight. The other thing that's really difficult after a fusion is putting on shoes, and so that hip hinge really comes into play again. If you're sitting and you go, how do I get all the way to my foot? You can bring your foot up towards you if you've got the flexibility, which is another good thing to practice before you have a surgery, so that you can get to your shoelaces, hinging at your hip to get there and tie it without having bad posture and going against your surgical precautions. So I hope that helps. Thank you.